Hi, everybody. I'm Digby Tantum, and I'm very pleased to be talking today to Dr. Nancy Hakim Dowek, who is the course leader of our D-Prof in existential psychotherapy, and is one of our two doctoral courses. Nancy has given presentations in a number of places and organizations about her own background, which she rooted in two cultures, as she says. And so I'm going to be asking her today, particularly about cultural diversity and why psychotherapists and counselors and others should know about diversity and how they can be taught to know more about it. So over to you, Nancy.
So I think generally speaking, mental health matter and awareness are raising, and as a result, more and more people are seeking psychotherapy, people from all sides of society. And as our society is increasingly characterized by diversity, ethnic, cultural, religion, and so on, as therapists, we need to keep ourselves informed, and we need to have an understanding of the context in which our clients are living their lives. Uniformity as such in psychotherapy is becoming irrelevant if it's based on a one-sided perspective. It is really important that we educate ourselves, and we, as I said, we keep ourselves informed. We need to become diversity competent with the ability to contextualize the life of our clients, to understand the way they are and the context in which they are living. Some radical streams in psychotherapy have questioned the application of mainstream psychotherapy's theory on everyone, and they argue others argue that humans are human and their concern and development are similar no matter where they're coming from. What I think is that actually we need to hold both approaches together simultaneously. So we have shared givens of existence, we have shared experiences, but also we need to hold the different context in which these are experienced by our clients to understand their experience of being in the context that they are evolving in. It is really important to understand that these are not mutually exclusive. Both are important in therapy because worldview matter in the therapeutic relationship. And as therapists, we must become aware of our own position in the world and then understand the position of our clients again, and the context, the cultural context, and the values they're coming from. To understand their experience, we need to grasp their personal, social, and spiritual environment. Otherwise, we say we want to meet our clients, but how can we meet them if we don't understand the complexity of the context in which they are evolving? So unilateral perspective is not an option anymore. We need to broaden our perspective and our understanding of different cultures, so we can actually really be present with our client and forge that therapeutic relationship that is the heart of the therapeutic endeavor.
Thank you, Nancy. That's very, very clear. I'd like to ask you a couple of follow-up questions, if I may. The first is, you can understand, let's say, about Jewish culture by going to see a film about Judaism, or you can understand it through asking a particular person who's been brought up in the Jewish tradition, which is, as I know you will know better than me, very varied, about their own particular experience of being Jewish and what it meant for them. Do you think which of those is more important for the psychotherapist, to get that into that personal world of somebody who is Jewish, or to just get a general sense of Jewish history or Jewish, you know, writing, whatever?
In a way, it's firstly neither this one or the other one, is the understanding that there are different perspectives, because today I will have a Jewish client and tomorrow I will have a Muslim one or a Hindu one. It's not only about knowing about the specific religion, is the understanding and the broadness and the openness to hear somebody else's context, and then to go and learn a little bit about it, inform myself about what it means to be Jewish, because what it means to be Jewish, if you ask 3 people, you will have 5 opinions. Everybody have a different experience of that. So it is about the client's experience, but you need to have some basic knowledge of how to conduct yourself and how to listen in order to be able to understand the meaning that the client is ascribing to their religion, whatever religion it is. So it is also about the attitude, not only about the specific religion, and it is becoming exposed to all kinds of religion that can help develop and cultivate that kind of attitude.
Right. Okay. Yeah, that's very clear. So you have a client in therapy who has been very depressed. And as the therapy progresses, they disclose a virulent hatred of a particular other culture. Maybe once that it is the culture of the people they live amongst and leads them to be very disparaging of the people they live near to. Is it the responsibility of the therapist then to engage with that? Or does one simply close your eyes and ears to this unpleasantness in your client and just deal with their presenting issue, which in this case will be depression?
I will always say it's both. You can't really just address the depression if it is linked to a cultural context or family context, even if that context is triggering that kind of hatred and is not equal to my values of culture or family or whatever it is. So I need to be engaging with both in both ways. A, because I need to understand what it means to the client to live with such hatred. Maybe that hatred is fueling the depression, maybe not, but it is certainly informing something of their experience of being. So I absolutely need to be engaged with that. I don't need to agree with that. Engaging with the work doesn't mean agreeing with the work. That's how this is why I need to be aware of my own values and understand the other person's value, so I can work with that rather than be triggered by that or be offended by that for any reason. Or as long as we are working within the ethical framework that we are all bound to work with, we must engage with everything that the client comes with. Otherwise, I think we're not doing our work properly. And our work is to be there for them, for, wherever they are. And in order to do that, we need to engage with everything.
Right. Thank you. But as I think about the question, obviously it's a wider one, isn't it? If you work with somebody who is openly racist, if you, I don't know, carpool with somebody who's openly racist, to be silent in that situation and not to engage with them is almost condoning their racism, isn't it? It's, as you say, for a psychotherapist, understanding doesn't mean condoning, but if you just are in an ordinary situation with other people. So do you think we have a duty to express opposition to people who are racist or discriminatory in their attitudes to us or to other people in the workplace or in leisure situations or in our sports clubs? Or
I used to think in the past that we can choose to react or not to react according to the situation, and some situations are requesting, we can require from ourselves to ask ourselves to react, and other not. Today, more and more, I think I can talk only about myself. I will today make my opinion clear. I will not necessarily engage in a discussion or in in a confrontation with them, but I feel I have the duty and the responsibility to be clear about my position. Just because, there is a say in English, I think it takes a few good people saying nothing for a terrible thing to happen. And the more I mature in my profession, the more I understand how important it is not to keep quiet, because by keeping quiet, in a way, we are not condoning, but we are not doing anything to stop any of that. So engaging in a dialogue, not necessarily confrontational, I think today is my responsibility. Yeah.
Thank you. That's very clear. I think I would agree with you, although I also recognize it would be very hard sometimes and would risk, perhaps sometimes even some kind of aggressive response, or so one needs to be very tactful. But on the other hand, as you say, if one doesn't say anything, it can be misread as agreement, or it's a bit like trolling on social media, isn't it? If you let the trolls dominate, they get empowered rather than burnt out. Yeah. Anyway, thank you very much, Nancy, for contributing a diversity bite today. And you've touched on some very useful and important issues. Thank you.